My name is Dr. Kimberly Sue. I'm an addiction medicine doctor and an assistant professor of medicine at Yale University School of Medicine. And I study harm reduction, I study drug treatment, and I study gender and women. So harm reduction has many definitions, but a basic definition in the addiction medicine field is a wide-ranging set of practical strategies and ideas aimed at reducing the negative consequences associated with behaviors like substance use or sex work. Xylazine is a veterinary tranquilizer. It's not approved for human use in the United States. It's commonly used in animal surgeries as a sedative, as a pain reliever, and a hypnotic. From what we do know, xylazine has been expanding in the US street drug supply over the past 5 years or so. We know that it's up in all US census tracts, but that varies depending on the region. It also depends on if people are even capturing that data. So there was a recent study that came out in the last 1 or 2 years, which showed that xylazine increased in the rates of overdose deaths from less than 1% to 6.7% over the course of the last 5 years, so from 2015 to 2020. So it's increased substantially, but depending on what region you're in and if we're keeping access to that data, it could be very different. So for example, we know that xylazine is more prevalent in states like Pennsylvania, Maryland, and Connecticut, where they've been keeping the data for a long time. Less is known about the West, the Southwest, and the South. Xylazine in humans, again, with the caveat that we do not 100% know about the actual effects of xylazine in humans because it has not been formally studied, is that it does cause, clinically, it causes low blood pressure. It causes central nervous system depression, which means that it sedates you, or it can decrease your drive to breathe, and it can also decrease your heart rate. There are a couple other things it can cause, like changes in your blood sugar, but the main effects are the low blood pressure and the fact that it sedates you quite significantly. So those are some of the things that we're worried about when we're seeing xylazine in overdoses, or we're seeing it mixed with other substances, because those things can potentially kill you. So there's no known or approved antidote for xylazine in humans at this time. There are some for animals, but those are not approved for use in humans. We do recommend that if you encounter someone who has a xylazine overdose or a suspected xylazine overdose, that you give them naloxone or Narcan, as you might do if you encountered someone experiencing an opioid overdose, and call 911 and get some emergency medical services and care. We do know that if you go to the hospital, you might need support for ventilation or for breathing. The paramedics or the doctors in the emergency room might intubate you and take over your breathing, and they might have to give you blood pressure medicine support to keep your blood pressure up, because xylazine can decrease your blood pressure, causing what we call hypotension, which can be pretty serious and pretty dangerous if not treated. The arrival of xylazine in the drug supply, it does change some things about responding to opioid overdoses, and some things it does not change. We do recommend that you respond to a potential xylazine opioid overdose that is mixed with responding with support for airway and administering naloxone or the brand name Narcan. So those things have not changed. Xylazine is not an opioid, and xylazine is not expected to come off the brain receptors if you use naloxone or Narcan. That's the same thing as alcohol. It's the same thing as other substances like benzodiazepines, such as Klonopin or Xanax, that people might have used. But we do recommend that since it's largely present in the drug supply as an add-on or adulterant to fentanyl or other opioids, that you do try to reverse any potential component for an opioid overdose, because that could save someone's life. So we do, again, recommend that you call for additional assistance because, like I said, there's no known antidote for xylazine. People might need to be monitored. People might need reversal agents for other substances that they have on board as well. My patients describe that in 1 or 2 days, an area where they may have injected becomes black, it becomes necrotic, and then it grows into, it can really become confluent into a much larger wound that can be a larger part of the body surface area of the skin. And it can have varying levels of healing and harm. So we do suspect that these wounds are from the local blood supply in the area goes down because of xylazine. So vasoconstriction is a medical term. But also I suspect that there's something locally toxic about xylazine that is causing this damage. And they themselves are not necessarily infected, but they are at risk of infection, especially if these wounds get larger. So they get larger, and the skin is your natural barrier against infection. It has been some controversy about if you can get the wounds from sniffing or snorting a xylazine in a substance. And largely in my patient experience, I have only seen it in people who are injecting fentanyl with xylazine, for example. And we are not sure, this is an area for further research, again, very important research about if these wounds are coming up from other routes of administration of using drugs. I've been pretty happy to hear that the Biden administration has drawn attention to the xylazine problem. Xylazine, like you said, is increasingly prevalent. It's increasingly part of the fentanyl supply. We need much more funding for research on this, research on it in humans, understanding of the basic epidemiology. We do not know how prevalent it is in all states. We do not commonly have money or support to test for xylazine. And so all of these things are really important as we try to take care of people who have xylazine overdoses or xylazine-related wounds. It is pretty important to not further criminalize xylazine, to schedule it in the Controlled Substances Act, in my opinion. We do know from previous efforts with other substances like fentanyl that criminalizing it, sending people to prison and jail for it, it does not help. In fact, it only harms people who are suffering from substance use disorders. And those are people who are often, experiencing a lot of poverty. They're experiencing a lot of structural barriers that make them predisposed to be caught up in the criminal legal system.